Hi guys, welcome back to the Mental Health Quarters. I know it's been a while we've had our Mental Health Beyond Borders series, but I'm so excited because today I'm having my second South African on the channel. And this South African is very, very dear to me because I reached out to her. It's a long story, but I'm just going to cut it short. So what happened was that last year she came to Ghana, and my psychologist told me that, oh, there's a Dr. Samke in Ghana. You should reach out to her. And I was just wondering how I'm going to reach out to her. Then I I found out she was having an interview with Joy News, which is a local station in my country. So I watched the video and I resonated so much with her story. Immediately I sent a comment. Usually I don't send comments on social media, but I had to send a comment, and thankfully my comments was read out on the channel.
That's from Essay Draw on Facebook. Says, thank you for sharing your lived experience with us, Dr. Samke. As a person with lived experience with bipolar disorder too, your story is very empowering.
Oh, wow. That is so wonderful to know. Thank you so much, Essay.
But after that I made sure I sent her a message so that she will not forget who I am. And I thought maybe to get lost in the DM box or something. But she replied. She was so sweet and nice to me. And since then, we've been chatting on WhatsApp from time to time, and I enjoy watching her status. She's such a lovely person. So, Dr. Samke, you're welcome to the Mental Health Quarters.
Thank you so much, Esanam. This is such a privilege for me, and I've been really looking forward to the session.
Yeah, it sometimes surprises me how enthusiastic you were about coming to the channel, because usually I'm the one chasing the guests, begging, but you right away you wanted to do this, and I was like, am I dreaming? But I'm so glad that you agreed to do this, because usually it's not like this.
Uh,
So thank you very much. I really appreciate it. So, Dr. Samke, can you tell us a little bit about yourself?
so I'm Samke Ngcobo. I am from Durban, South Africa, which is the town in KwaZulu-Natal. I'm currently residing in Johannesburg, which is one of the cities in South Africa. I am somebody who is living with mental illness. The diagnosis is bipolar disorder, diagnosed at the age of 14 years old. And so I've been navigating this condition for most of my life now because I'm now 38 years old. I am somebody who's a passionate mental health advocate because I've seen what stigma does to people. And I also have seen what overcoming stigma and living a quality life is possible with this condition. So I've really had wonderful opportunities to engage with people like you, SNM, who are very clear in your purpose and calling, how your purpose, how your lived experience has been intertwined with your purpose. So this is who I am.
Okay. It's that I know you have just given us a summarized version of yourself, but I'm sure your journey, your road to recovery, your mental health journey must have not been easy, because for me it's just this year will mark 10 years on my road to recovery. So I was doing this in my early 20s, but you started your journey as a 14-year-old, a teenager navigating all this, and here you are today. For me, you deserve so many medals because it's massive. You deserve a lot of medals, even more than Olympic medals. Everybody deserves a medal for every stride that they make. So I would like you to complete this sentence for me. Dr. Samke's self-care routine includes.
It includes God, very primary to my life. And in saying that, it's prayer, it's listening to gospel music, it's praying with family, going to church. It includes reading, it includes writing. For example, I even have a book of my own that I
Oh,
wrote.
that's nice.
So it's a passion of mine to write. It's a passion of mine to read. I love speaking and sharing. It's important to me to go out with friends. I love solo dates. Solo dates include me just going out for coffee. I might be having lunch by myself or just having a cup of coffee. But it helps me to de-stress just to do a solo date, just to collect my mind. I think it includes mindfulness and self-awareness where I can reflect. So that's what my self-care looks like.
I'm so jealous right now because everything that you are saying is like, Dr. Samke is living the life. You are the model mental health advocate. Everybody should be doing what you are doing. Yeah, that's amazing.
Yes,
And
but I did forget to mention that a very important part of my self-care is the managing the professional management team that looks after me as well. That includes my psychiatrist, that includes my psychologist, that includes that and my medication. So that's also part of my self-care and also holding myself accountable amongst other things.
yes, that's very true. I tell people all the time that when you see someone thriving on their road to recovery, it's like a cocktail of different things. They are doing so many things by themselves with a team. It's like they are doing every single thing to make sure that they are healthy. So I find it very sad when people focus on just one thing. So maybe they say, oh, they are focusing on just their faith to recover. I tell them faith is good, but also work with mental health professionals, do your self care, do the things that help you de-stress, do everything. Don't just focus on one area, or maybe I'm taking medications alone. You are not doing any other thing. You won't see results. So everything that you've said, I agree with you 100% because I've done some of the things you've talked about and I have seen results. And it's very amazing that even though you are not living in Ghana with me, you are in South Africa, whatever you are doing to make strides on your mental health journey. If I'm in Ghana and I apply them to, I also get the same results. That's why this series is called Mental Health Beyond Borders. We all have mental health. And when you have mental health, it doesn't mean that there's something wrong with you. Once you have a brain, you have mental health.
We have more in common than not.
Yeah.
When I came to Ghana, what stood out for me is that as much as I'm from South Africa, all the way down the tip of Africa, and you in the west of Africa, we have more in common than things that make us different.
Yeah.
And the other thing is, our support structure is multifaceted. We are not just spirit, we are mind, body, and spirit. So you can't just say you're intervening using one means or one tool. There's different aspects to what makes us well.
Yeah. That's very, very true. And for you, a doctor, to say that it's very amazing because people have this perception that, oh, doctors, they don't believe in God, they are just, atheists, all they believe is in science. So coming from you, it's very powerful. Yeah. You you
Mhm.
said that you were 14 when you were first diagnosed. Tell us, how did it all begin?
So they didn't overtly say I have bipolar disorder at that time. I mean, I think the understanding was not as great as it is now. They just
Yeah.
said I have a mood disorder, and I can see there's a number of things that were not done properly at that time. Number one, I don't think my family was sat down properly to have it explained to them. For example, no one counseled my parents to explain to them what was happening to me. So I had a very severe, what is called an index presentation, is what I displayed. An index presentation is your first episode with the illness. So you say you've been navigating it for 10 years, if I'm not mistaken.
Yes, 10
So
years.
your
This
index present so, yes, so your index presentation was 10 years ago, basically. So my
yeah.
index presentation was 20 something years ago. That's what an index presentation is. And no one sat my parents down to explain what is this condition, what must be done to manage this condition. I had a very severe manic and psychotic episode when I became ill for the first time. And people said I was exposed to all sorts of stigma. because people did not understand what happened to me. So people believed that I was bewitched. Others believed that I was demon possessed, and they were pointing at various things at my home that were the cause of the problem. When people came to pray for us, they didn't want to drink from where we were drinking because they felt that it would be contagious. So it was very little understanding. This is a town in 2001. And it's unlike now where we have mental health advocacy, where we have the internet like used, where you can Google your symptoms. There was very little understanding. And imagine being a 14-year-old being blamed by people that you are the weakest link. So it was a very lonely time. I didn't understand. And when I was admitted to hospital, I remember being exorcised whilst in the ward because they believed that I had a demon inside of me. And they made me shout the name
Wow.
of Jesus while I was in the ward. So it was quite a traumatic situation. And I remember it as if it was happening yesterday because it was such a life changing situation.
Yeah, and that must have been a lot for a 14-year-old, especially looking at how it must have been very difficult for you to navigate your own, your diagnosis, coupled with all these people now calling you a witch or demon possessed. And that must have really, really been a lot for you. And I'm
I
looking
was
at,
very confused. I was
yeah,
very confused.
yeah. I'm looking at you now and I'm like, why would they think a pretty lady like this was demon possessed?
I think you know what happens when people don't understand something, when people are confused and ignorance leads to all these misconceptions. And they said I didn't pray enough, and that's why the demon came through me. There were so many explanations because people didn't know. So I say that people did what they best knew how. I am grateful. I think one of the biggest messages I want to share with people in me being diagnosed at such a young age is early intervention improves prognosis. So the intervention for me was early on in my life, number one. Number two, my parents pursued the appropriate support and help, which enabled me to live the quality of life that I'm doing now. Yes, there could have been
Yeah,
better things being done, but they did the best with what they knew how at the
yeah.
time.
Mm. That's very true. And what were some of the symptoms? You talked about the index present. What were some of the symptoms that you experienced at that age? Because usually, because I was diagnosed in my early 20s, when I'm thinking symptoms, I'm thinking about, being an adult, going on spending sprees, living recklessly, doing. So every symptom in my head is adult symptoms. So I'm just wondering what was going on as a 14-year-old.
That's a very important question that you're asking me. So one of the things was that I was pacing around quite a lot. I wasn't sleeping anymore. So I was spending even 2 to 3 days not sleeping. I was
Wow.
pacing around. I was speaking very fast. I was also having psychotic symptoms. So I was also paranoid. At that time, with the telephone, not just cell phones. So I felt that people were listening in on my conversations on the phone. I felt that the radio was communicating with me. So I was also saying that deceased relatives were communicating with me. And that's when my parents became worried. I was having mood swings. I was very irritable as well, which is also a symptom that I still have as an adult when I'm not well. The irritability becomes quite marked.
Mm,
So when I was being irritable, I don't think they paid that much attention to it because teenagers, the mood swings are a common thing. But when I started having symptoms where I said I was communicating with deceased relatives, that's when they became worried. And I also started to undress and run around, and I was trying to run out of home because I felt that I was in a prison. So that's when they really became scared and rushed me to the hospital.
yeah. You speaking about wanting, there was a time when I was manic, my first year. I was at home, because of my symptoms. My parents didn't want me to go out. So I was just at home having this voice in my head tell me, you know what, just run out naked. Nobody will even see you or remember you. You are invisible. And I actually wanted to do that. So I've never heard anybody like share that. I used to think, oh, that thing that happened, it was just something really off. I've never had anybody with bipolar disorder also share that they wanted to run away. And that the psychosis, they're hearing voices and seeing things that are not there. I also used to experience that. And it starts looking like you are going crazy. And everybody starts to wonder. For example, my first doctor actually thought I had schizophrenia because most of my symptoms were presented like this girl has schizophrenia. It was maybe a few months later and someone saw me, it's like, no, you don't have schizophrenia. So the symptoms can be extreme. People just think about the highs and the lows. Maybe you being extremely happy and then extremely sad. When they think about bipolar disorder, that's all they think about. They don't think about all these things that you have mentioned.
The important thing for people to understand is that schizophrenia is a psychotic disorder. So then you have those psychotic symptoms that you've mentioned, hearing voices, seeing things, being paranoid, delusions and hallucinations, for example. The reason why people with bipolar can be misdiagnosed as having schizophrenia is because you could have you can have a manic symptoms with psychotic features. So so you have the mania with psychotic symptoms. And when people see you with the psychotic symptoms of the bipolar, they can confuse it and then think that you are having a psychotic disorder such as schizophrenia. So that's a very important thing that you're highlighting. And you're saying the commonality of the symptoms. I think sometimes the things that we do when we're psychotic are so cringeworthy and embarrassing that we don't say it. There's so much shame that is attached to our condition that you don't want to tell people what you go through. But the only way we can overcome stigma is to shine a light on the shame and expose it and to say, you did those things in a state of being unwell. It doesn't mean that that is who you are.
That's very true. So I keep calling you Dr. Samke. I'm sure people must be wondering, oh, so she's a doctor. How did she balance her medical condition with her medical career? Tell us, how did your condition affect your journey to being a doctor?
It was very difficult. I don't want to lie. So I've always been gifted academically. I'm grateful that I've always been a high achiever in school. I've never struggled with school, but my illness interfered with my studies. In medical school, that's when I became sick most frequently and had my most frequent admissions, to a point where they said my prognosis with my illness was poor because I was relapsing so many times. I was becoming sick so many times. I was being admitted to hospital so many times. There's times, sometimes once a year I'd be in a hospital for 2 weeks. Sometimes twice a year I'd be admitted to hospital. So first year, second year, third year, I had a bursary to medical school because I performed very well in matric. But to maintain the bursary, you have to keep performing well for it to be renewed. But my studies were interrupted by my illness because I'd missed school because of my illness being hospitalized. And I was in denial about my illness. Nobody educated me about my condition. All I was told is that I have this condition. So intellectually, I sort of acknowledged that I have bipolar, but I didn't accept it internally to say, what does this condition mean? So here I am expected to take these pills. No one is explaining it. I'm gaining 30 kilograms in a space of 4 months. So I stopped taking that medication. I would flush it, I would throw it in the bin. I did everything but to take it. And it was frustrating for my family because they were thinking that I'm refusing the help that I'm being offered. But the reality is that nobody sat me down. Do you know that I was diagnosed with this condition in 2001 at the age of 14? But it took 16 years for me to finally accept it. So even though I intellectualized it, I only finally met a psychiatrist who explained the condition to me properly in 2017. So all along, I was ashamed. You would know that what we learned very early on with this condition is to learn how to be ashamed of the condition because of the stigma of what people say about the diagnosis. Oh, that one has bipolar. If somebody's acting funny at work, oh, that one has bipolar. If a relative is acting strange, oh, that one has bipolar. So I learned very early on. And me in my medical training, I would see people I'll see patients in the ward that were so sick, and I would think that cannot be me. So one of the things that I'm passionate about in my advocacy work is to say I am living proof that the diagnosis is not who you are.
Yeah.
And it was a risk that I took to say, as a doctor, how will people receive me if I
Yeah.
share that I'm a medical doctor who has this diagnosis of bipolar disorder? But I only opened up publicly about my diagnosis 5 years ago. It wasn't, I haven't been talking about it all my life. I would only share with friends and family, but to be public and meet amazing people like you, it's when I had a public episode 5 years ago, and it changed my life completely.
Okay. So, you say you were in denial for 16 years. I was in denial for 1 year. And I tell anytime if someone comes to me, or I have this friend or family member that is newly diagnosed, they don't want to take their medication and they don't want to accept their diagnosis. And I keep telling them, nobody is I feel like everybody goes through that state of denial. It just the time frame varies. For someone it can be 1 year, for someone it can be 16 years. So it will definitely pass. Some things will happen that will make them understand that, you know what, accepting this diagnosis doesn't mean that I have accepted my life has come to an end. It's just accepting that this is what has happened, and I need to put in measures to deal with it. And it's very for you to be in denial for 16 years, a lot must have happened. I mean, the throwing away of the medication, and I also did the same thing because my issue was if I take the medication, it's like I'm telling God that he can't heal me, because most people around me, I'm a Christian, so people will come to me and tell me, by his stripes we are healed, you there's no need for me to take this medication. So I felt like if I take this medication, God, I'm saying you can't heal me, and it means that maybe for the rest of my life, so why don't I just be a faith-filled Christian and not take this medication? So that was where I was having that issue till I had a doctor who is a pastor in Ghana talking about how there's nothing wrong with taking medication for your mental health. So when I came to that understanding after a year, I was like, even this pastor is saying he's a doctor. Then too, he believes that like these things you can manage them. So that's why I'm very sure if I didn't listen to that podcast, I would still have been in denial for another year. My symptoms would have gotten worse, and all of that.
Yeah, no, I believe that, unfortunately, I have to be honest with you, Esther, as well. As somebody who's worked in mental health care services, I was working in the Department of Psychiatry as well. Sometimes people don't accept it for a lifetime. They just refuse it their entire lives. And that
Wow.
affects their quality of life. They are admitted now and again, and they end up in placement facilities because they are not manageable with their condition. They are
Yeah.
always being in hospital. The family is not coping. So others, it can take them a year. Others, it can take them 16 years like me. Others, a lifetime. They will never accept it because of lack of insight. So it varies. And the other thing you're saying that, people are saying by his stripes you are healed. I always say that there's a level of being irresponsible of people who say that. And I'm saying this as somebody who's a staunch, committed Christian. And I love God and I'm Christian. My faith is important to me. But I'm also a scientific person where I'm saying that there's HIV, it's a chronic illness. By a structure you heal, but God created the wisdom in the science to treat these conditions, to take ARVs. You take ARVs, you have HIV, you continue, you can still have faith. And the same thing applies with bipolar disorder. God created the intellect and the science behind the treatment for us to
Yeah.
take it and remain well and be able to talk the way that we are. God gave the people the wisdom. That's how I make sense out of it. But it doesn't mean that you stop our treatment. It doesn't mean that you're also lacking in faith.
Yeah.
I agree. I always say to people, people have told me that one day I'm going to be healed. And I'm like, I believe God is a healer, but healing comes differently as well.
Yeah.
My healing, I need to take my treatment every single day of my life. It's
Yeah.
not a death sentence, but it's to say that I need to be well. And to be well, I need to take my treatment. And in taking my treatment, that is how I remain adherent. I have relapsed one too many times to keep
Yeah.
questioning and arguing about this. I have been in mental health facilities more than 10 times in my life. More
Wow.
than, and I'm there for a week or two. So I can't keep running around in circles in denial about this reality that in order for me to manage my condition, I have to take medication. That's a non-negotiable to me, and it doesn't mean that I'm lacking faith by doing so.
Yeah, you just reminded me of something that happened to me, I think 2018 or 2019. My friend invited me for this camp, and the pastor prayed for me and all. And after the prayers, he told me I'd been healed. So I was like, when I come home, am I supposed like I was still at the camp. I was like, should I still take the medication now that you have been healed? It was like, oh, there's no need for me to take it. And I told him, I've seen what happens when I don't take this medication. I relapse and I do some things that hurts me and hurts the people around me. It could be financial, it could be emotional. I was like, oh, now an atmosphere like this, I'll not relapse. First thing I noticed that night, I couldn't sleep well. Then I thought, okay, maybe my body will adjust. By the time I came home, I spent all the money in my bank account. I was just a horrible mess. So since then, I appreciate it when people talk to me about, my mental health, me recovering and all of that. I told them, Amen, I receive it in Jesus' name. But privately, I still pray for my healing and still take my medication daily because I can't afford to relapse. If I relapse, I wouldn't even have the faith to, continue praying for my healing. And that there are levels on your mental health journey. There's a level which, when you are newly diagnosed, it's like when you relapse, it's like everybody knows that's how you are. You're always relapsing, they adjust, they understand. But there's a level which is like everybody is sick and tired of you relapsing. So next time you relapse, everybody's not going to be as nice as they were to you or not get hurt by what you are doing. Or you have reached a level in life where you can't I tell people I can't afford to relapse because I feel like I have reached a level of success that I don't want anything to get in the way of that. I don't want to destroy whatever I have built. So I need to be mentally healthy all the time. Uh-huh. So you just made me remember that story.
You know what? The other thing is, these are the same people who would describe me as demon possessed, the same believers
Yeah,
who said God put a demon in a 14-year-old young lady. So my faith and my condition was a struggle for me. I had
yeah,
to work out my own religion and my own relationship with God because the people I trusted laid me down. They accused me of having caused my own pain. So when people tell me that one day I'll be healed, and healing comes in different forms, even from a biblical perspective,
yeah,
people were healed differently.
yeah,
The blind weren't always healed in the same way. So my healing comes in the form of taking my medication consistently and looking after myself holistically. My faith is important, but it is not a substitute for
yeah.
me taking my medication.
And as a doctor, I know doctors, your work is high level stress environment. Stress is everywhere. And stress too is one of the triggers for this condition. So I'm just wondering, how have you been able to manage that level of stress and then your mental health?
I have an amazing psychiatrist. She speaks the truth in love at all times with me. And I can be up the whole night for 3 days and not sleep and not be tired. You know how it goes with bipolar. You could be
Yeah,
awake for 3 days and still not be tired.
yeah,
And being a doctor, I was able to it was great for medical school because you need the time to read your textbooks. Obviously, I didn't know there's a manic state in that way because you are studying the whole night, sleeping 2 hours, and you carry on with your day and you're fine. But you know that the level of functioning does become impaired eventually because you become tired, you crash and burn, you make mistakes, that kind of a thing. So when I started my training to be in psychiatry, and I became a registrar. So I think you'd call it residency in Ghana. Would you call that residency, right? So at that time I was in second year, and the hospitals were becoming very busy, and my physical, it was taking its toll on me physically, right? And my psychiatrist suggested, why don't you just work in a quieter place, like be in a clinic and, work like an 8 to 4 in a clinic and don't do calls 36 hours because physically it's a lot for you. And I became upset with her. I felt like she doesn't believe in me. I became very
Yeah,
angry with her. And I
yeah,
continued with my journey. So I've never been a danger to my patients or anything like that. And I've always loved work. I've always loved psychiatry, particularly because for personal reasons, because I'm living with an illness.
yeah.
And I,
You it's
and as a joke, my original dream was to be a teacher up until I became sick at the age of 14. And then I
mm,
became curious. I became curious about mental health after I had my episode. I thought I really want to understand the mind. So then my choice when I finished matric, I wanted to either be a doctor or be a psychologist, but
oh,
anything to do with the mind. I knew
oh,
that my calling has to do with mental health. I just didn't know it would be in this way in ministry and starting vocal mentality. I think I told you read about vocal mentality. So I thought my route in mental health would be to be a psychiatrist. So my training continued, the calls would become busier, my medication had to keep being adjusted. My medication makes me sleep. So I would
yeah,
struggle now if I'm being called at 3 o'clock. I'd be called at 3 o'clock in the morning to see a patient. And it was so difficult for my body to wake
yeah,
up and go and attend, number one. Or I'd struggle to get back to sleep. So I'm on call and I'm awake. After I'm done on a hectic call, I carry on, I'm going to the mall, and I would go on a high as well. After being on call, I'd reward myself by overspending. I didn't look at it that way, but I'd always reward imagine if you're on call every 4 days and you're overspending, that's not healthy. So I've had
yeah,
a number of adventures. I've had a number of adventures with my illness um, because of poor decision making. But
yeah,
it got to a point where my psychiatrist said, Samke, I don't think you're suited to being on call because it's taking its toll on your mental health. And
yeah.
now I'm in a situation where, uh, long story short, I started my own company called Vocal Mentality, where I support people in pressured environments. So I work a lot with corporates, and I provide advisory supports and how can people manage with their illness. So it's from lived experience, which is my lived experience. I share that in companies, and also to educate from a professional perspective, but also to support families. How can they cope? And that's why my book, Reflections of a Convoluted Mind, is my love letter to people who wish to understand their own illness, and it's my love letter to families who wish to understand the journey. So there's also my website where I try and invite people to create a community, and my newsletter. I don't know if I've told you, essay about my newsletter as well.
No, not yet, but I know you do a lot of things. I wouldn't be even surprised if you have a podcast because
Yes, there
yeah,
is
I
a
know about
podcast. There is a podcast coming up, and by the time you release this, the podcast will be released. So I've
your
partnered up with a friend of mine who's a psychiatrist, and there's a podcast for the whole of Africa, the whole of the world to watch about mental health.
I like the way you do your advocacy. It's not like you are just targeting people with lived experience. You are targeting their caregivers, their doctors. It's like everybody is involved. Don't say that you are not involved. And I'm so happy that you have a very great support system. You have doctors that can be honest with you and tell you the truth. I mean, when I also started my journey, I mean, when I finished school, we have this 1 year we call national service where you go and work at a place the government posts you to. And I was thinking about working in as a teacher in a private school. When I told my psychiatrist, my psychologist about it, she told me that's a very high pressure environment. And I didn't want to listen to her because I felt like you said, you don't believe in me. I'm not the one who is helping me to get better. So what are you saying? You don't believe in me. So you are trying to say I will not be well. I can't be like my friends, that kind of thing. And it was true. It was highly stressful, stressful environment, and the stress started showing in, like I could feel like I was starting to get worn out. Everything was just wearing out, and eventually I broke down a little, and then they found out that, I mean, I opened up to a member of management, and she went and told everybody, and that's how I lost my job. But when they fired me, I was actually really happy because I was like, you have no idea how much you have set
You
me
were
free.
relieved. You were
Yeah,
relieved.
yes, because it was too much. I remember there are times when I'm commuting to work, all I'll be praying is, God, please don't let me relapse. God, please don't let me relapse. Because I could see what it was doing to me. So I'm just happy that what your doctors like just told you the truth, because sometimes it's very difficult sometimes for doctors to tell patients the truth, because the patients may have an outburst and all of that and refuse treatment, and you are thinking about what could happen if you lose the patients completely, and you wouldn't tell them the truth. So I'm glad you have people like
Oh,
that.
I always say that, there's a part in my book where when I'm thanking people, and I'll open up to it now. It's just a very close enough play part.
Is your book on Amazon?
Yes, on my website, there's a link to my book, and the
Oh,
link leads to Amazon. So www.vocalmentality.com. And
oh,
then if you go on my website, there's a link to my book to order on Amazon. Reflections of a Convoluted Mind,
okay.
a journey with my mental illness. So there's something I'm dedicating to my psychiatrist, and I said this: never in my life's journey did I think I would encounter a doctor of your caliber. You have remained my mental health activist and advocate when I was failing myself. So,
Beautiful.
there's times where I failed myself even as a doctor, like for myself, even though I have medical knowledge and work experience working in mental health services, I still haven't done the best things for myself. But my
Yeah.
psychiatrist is my safety net, where she tells me things that I don't want to hear. She tells me the truth. And I always know that because she's always been on my side, she will tell me the truth in love. And that is why, even if I don't agree with her sometimes, because
Yeah.
I trust her, I go with what she says.
That's very beautiful. I mean, and I know people that sometimes they think the psychiatrist is their enemy because they are telling them things they don't want to hear, and stuff like that. How many years has she been your psychiatrist?
Since 2017, it's the first person in my life out of my mental health team who finally explained my illness to me. So for 16 years, I was being given medication, but there was no consistent follow up,
Yeah,
there was no consistency. And I
yeah,
was sort of like fine, and then I'm not fine, fine, no, like extremes. Now I'm able to see red flags in my life before it's something like a psychotic episode. It's so severe. When something is wrong, I'm not sleeping. People will tell me, doctor, or she will tell me, Samke, I'm concerned about you. Or my loved ones will say, Sam, why are you online on WhatsApp at 12? You don't sleep at that time. So they see that, oh, my voice notes become podcasts. Normally a voice note is like 1 minute. Next
yeah,
thing I'm releasing a voice note that's like 10, 15 minutes long, and it's a
yeah,
podcast. And then
yeah,
that's a red flag. So it's very important to have insight about your condition.
yeah,
And that is how you learn. So it's important to receive feedback from your loved ones, the trusted loved ones, obviously the ones who don't stigmatize you. It's important to have a safety net of people who you can be vulnerable around and can trust.
yeah. That's very, very true. I mean, when you talked about the voice notes become 12, 15 minutes, I mean, don't, people think that when you are manic, you should know you are manic. can't you realize you are manic? I'm like, you have no idea. It's like me personally, I feel like someone has taken over my mind. I don't know what I'm doing. I don't know what I'm saying. It's not intentional that I want to send a WhatsApp group 15 minutes voice notes. It's like you have no, and sometimes people think you should know, just snap out of it. I say it doesn't just work like that. When you are sick, like you have malaria, you don't just snap out of it like that. It doesn't happen like that. So why is it that someone is having a mental illness? It's like, oh, you should know what you are doing. If you have depression, snap out of it, get out of that bed. Like you have no idea. It's tough.
It's because mental illness is invisible. Like
Yeah,
you can be dressed well, but be very manic and be very psychotic.
yeah.
So unlike if you break your leg, you will wear a cast
Every
and
yeah,
people know, and you're using crutches and they can see you've
yeah,
broken your leg. If you're
yeah,
psychotic, you are dressed well. Maybe you might not be making sense when you're talking, but if you're quiet
yeah,
and sitting in your corner in your suit,
yeah,
no one is going to know that you're unwell. And that is why people don't have empathy about people with mental illness, because they think that you are able to control your own behavior. But at that time, you're not well. The illness is not you.
yeah. That's very true. You talked about stigma and discrimination growing up. I mean, you faced stigma very early on in life. So I'm thinking now that you have come out, you are a public mental health advocate. Everybody knows you around the world. I'm sure people come to the hospital and they meet you, you are their doctor, and probably they know what you do and the work you do as a mental health advocate, and the fact that you have lived experience. Do they stigmatize and discriminate against you?
I think the worst form of street stigma I experienced was most recent. It was 5 years ago. It
Oh,
wasn't, it happened when I was 14, when I was young, but I didn't know it was stigma, if it makes sense.
yeah.
But when I became aware, like what the feeling of stigma is, it was 5 years ago. So that was the year of COVID, but it had nothing to do with COVID. I had a
Oh,
public, I had a public bipolar episode where I left voice notes in a group, in a WhatsApp group, about 10 voice notes in a psychotic state. So I was the admin of the group amongst other people, maybe three or four of us. But the more I became ill, I removed the other two people who were admins and I
I'm,
left myself to be admin. So you can imagine the chaos that resulted
yeah,
in. And in that WhatsApp group, people shared the voice notes all over. They rotated everywhere. They were shared by people who I worked with, who were colleagues. They were shared by people who I don't know. So that was a very traumatic time. And
yeah,
I became admitted to a state facility as an involuntary mental health care user because I was psychotic. And at that time, they didn't pay my salary. So I was not in a private facility, I was in a state facility for the first time in my life, which was horrible to say the
yeah,
least. I'm not saying state facilities are horrible. I'm just saying the one I went to was quite horrible because I got to see that, how you're not seen as a full human being if you have a mental illness.
yeah,
But I'm now thankful to God for the experience because I don't think I would be the vocal mental health advocate that I am had I not experienced that traumatic experience. So the most traumatic time with my illness related to stigma was when I had the public relapse 5 years ago.
I always joke with my friends who also have lived the experience with bipolar disorder that when you have such a public manic episode, the moment you recover, it's like you have to go on an apology tour, apologizing to every single person that you may have hurt or offended by your actions or your words. Have you also done that? And were the people always, oh, Samke, it's fine, I've forgiven you. It's all right, let's move on. Has it always been easy for you?
No, it hasn't been. I've lost relationships along the way. I lost a friendship as well. I remember one of my good friends who I went to varsity with, she actually told me point blank and said she's gone beyond her call of duty and she can't take it anymore.
Yeah,
And I was devastated to say the least because I loved her very much. I valued the friendship, but I had to respect her wishes when she said that, she's gone beyond her call of duty. This is beyond her. She really can't. And for me, I respected that because I knew that I can't guarantee that I won't relapse again. So if she's saying she can't, I couldn't guarantee that. And I've had relapses after that. So if she only can only be there when I'm at my best, when I'm at my best, I'm doing great. As my doctor says, Sanjay, when you are well, you are phenomenal. But when you are sick, you really struggle. So I couldn't guarantee to this friend that I'll never relapse again. And I think one of the things I write in the dedication in my book is this. I say, dear God, you are my sanity to my parents. And then the one thing I wanted to highlight in response to what you're saying is the part where I say, to those who have loved me beyond my struggles,
Yeah.
to those who have loved me beyond my struggles, because people see Dr. Samke who speaks on TV, who goes to Ghana, who goes everywhere, and that looks glamorous. But you and I
Yeah.
know that this illness is nothing close to glamorous. When we're not
Yeah.
well, when you're having a depressive episode, you don't want to get out of bed, you don't want to bath, you don't want to clean. It's nothing glamorous about it. When you're manic, when you're spending all your income in one day before your debit orders, there's nothing glamorous about being broke and stressing about income. There's nothing glamorous about it.
Yeah.
So I stick to the people who love me through the dark days and through the bright days. And I love the term you're saying about the apology spree.
Yeah.
That you are actually alluding to the reputational damage that results in the reputational risk that results in having an episode. So your apology spree, I understand what you mean, but the people who love me understand. They know me for who I am. So if I'm being rude or irritable, they are able to forgive and understand that when Samke was being irritable and rude, that's not her true self.
Yeah.
And I have a name. I have a name for my manic episode because I don't know. It's not me. Her name is Madam J. I
Madam
call her
J.
Madam J because
Yeah.
I've come to terms with the fact that when Madam J surfaces, it's not me, it's the
Yeah.
illness. So
Yeah.
I've personified the condition and I said the manic episode's name for mine, I call it Madam J. And then I'm more compassionate towards myself that, oh, okay, Madam J popped up at that point.
Yeah. That's very interesting. People don't know that when you see someone who has lived the experience with bipolar disorder, they've probably lost some friends, very dear friends, family members. They don't know that you must have embarrassed yourself many times, and people don't see. You're right. People don't see that other side. The fact that there was a time in my life where I wish I could just be be able to control myself when I'm manic and not hurt. It's not intentional, like I go around hurting people. And you're right, some people they've had it up to here. I mean, when I was manic and in university, there were people who noticed that I had changed and all of that. They were not empathetic towards me. But when I finished school and I got into advocacy work and it started, the glamour and everything, people are like, oh, I wish when we were in school and you were going through all of that, I was there for you. I'm so sorry. And sometimes I just say in my head, that was when I needed you the most. It's not now that everything is fine. I would have really appreciated your friendship and all of that, your support, if you were there for me or probably gone to read about this illness instead of judging me or laughing at me. There were people who I remember we went for this program once. It was like an outreach and it was highly stressful. And I had taken my medication probably late the night before. So when we came back to do a review about the outreach, I was dozing off. And some people took a video of me dozing off and put it on one of the church's WhatsApp group and they were laughing at me. My friend
Wow.
sent me that video and I cried because I was like, God, everybody is under stress. Why is mine seeping through the cracks? Why do people have to? And they had no idea that, oh, I actually take meds all the time. So if I'm not getting enough sleep, definitely I'm coming for that meeting and dozing off. It hurts my feelings because sometimes you feel great. I mean, when you are well, you feel like you are just everyone or it's everyone else. It just takes something happening for you to realize, oh, I have a psychosocial disability. So Yes, my own is a little different. People will definitely find out what is going on over here. So all the lost friendships we have had, I would say cheers to to them. If they were meant to stay, they would have stayed. It's fine if they are gone.
One of the things I used to be upset about that I asked God about is I'd say I'm a very private person, contrary to what people may think just because I speak openly. It doesn't change the fact that I'm a private person. And then I
Yeah,
have a condition that puts me in full view of being humiliated and I can't control my own behavior. And the saddest thing is when I'm behaving that way, people think it's the real, it's who I
yeah,
am, you
yeah,
know? So, but I've learned to just have compassion towards myself
yeah.
and the people who judge me for that, that's on them, that's not on me.
Exactly. When you were in medical school, did your lecturers or professors know you had bipolar disorder? And were they, I mean, supportive of you wanting to pursue this career? I have this friend whom she has a physical disability, and when she was in medical school, everybody's concern was, oh, you have an issue with your leg, so you may not really thrive in medical school. It's the same way to that because you have a psychosocial disability. I'm sure when people find out, oh, are you sure you can take care of people with that kind of thing? Were they always supportive?
The support in medical school was amazing. My professors were amazing. They encouraged me to seek psychosocial support, a psychologist, to see a counselor. There was student counseling. My illness was really flaring up. Remember, I said to you, I would get really, really
Yeah,
sick. But the thing is, if you have cancer, no one is going to say you must drop out of medical school because of cancer. If you break your leg, no one is going to tell you to stop going because you broke your leg. You know what I mean? But
yeah,
why is it that with a condition like bipolar, because bipolar is a condition, that is not who I am. It has
yeah,
nothing to do with my medical skills. If the condition is controlled and I'm taking my medication and I'm seeing the psychologist and psychiatrist, taking my meds, that does not impact and does not endanger my patients. And
exactly.
I'm grateful that that my professors were so amazing during that time. They knew when I was sick, I was in the hospital, I'd come back, I'd have to, play catch up with the schoolwork, but their support was incredible. One of the things that is important is to disclose in safe spaces. I'm not saying if you have a mental illness, tell everyone because stigma is the reality and people can use
Yeah,
that against you. But I've always made sure when I was having a work interview that I would say that this is my lived reality so that people have an understanding because people can support you better if they know what's happening with you than to find you disappearing from work or being absent and so on. But unfortunately, at certain parts in my career, the support hasn't always been amazing, unfortunately. But in medical school, my undergraduate was amazing.
okay. You are right about reasonable accommodations. And I tell people that on your road to recovery, like I always tell people, not everybody can be a mental health advocate because we are all on different levels of our recovery. When I was diagnosed in 2015, I didn't become an advocate till 2019. And that one is because I went through training and I realized I was ready to share my story. 2015, if you asked me to share my story with the world, I don't know what I would have been telling people. So you shouldn't always, you should share your story. You should share your story. People are entitled to share their story whenever they want to. But when it comes to you sharing your story to ask for reasonable accommodation, that is fine. And it's not even everything that you're supposed to share. I remember when I was done with my national service, I was going to apply for jobs. The first question I asked my psychologist was, so when they asked me about my medical, do I have a medical condition? What should I tell them? And she told me, like, if they give me a form, I should say no. And I knew where she was coming from because she knew I'll be stigmatized. So that job I went to do and I got fired from, they were the ones who asked me for that information. And I know if I wrote back then that I had a mental illness, they wouldn't have hired me. When I even got in, it's not because I relapsed or anything. Even if I told them I had diabetes, I'm sure maybe I would have still been working there. So it's all about, you know, reading the room and knowing what to share and how to share it. Right now, my identity is out there. I cannot be anonymous like I used to be some time ago. Because even if I lie to everybody that I don't have a mental illness, someone will definitely find out through YouTube or social media. So I can't hide that anymore. Sometimes I really wish I could be go back to anonymous, because I just want to feel like everybody else sometimes, but now I can't hide that aspect of me, and there's nothing wrong with it.
Like I said earlier, is that you break your leg, no one is going to say, "Oh, hi, here's the fractured person." But
Yeah,
you have a mental illness and you become irritated on one silly day, it's the bipolar. But you're just
yeah,
having a bad day. So people can't differentiate the illness from the person. And that is
yeah.
why it's a problem.
And I also don't like it when people, our support systems are good, they are solid, but I don't like it when they base every action on the condition. So, for example, there are certain people, sometimes I do sleep late. Let's say maybe I don't have work the following day, or I have something to do. There are certain people, when I see their message, let's say at 10 p.m., I don't respond at 10 p.m., because I know if I respond, they might think I'm having insomnia and I can't sleep. So I wait till the next morning to respond to them, because I just don't like, hey, you are not sleeping. And are you sure? But what they don't know is, I really, if I sleep late, I'm waking up late. I make sure I get my all the sleep that I need. I don't like it when they judge you. Hey, you're laughing so loud. Are you sure everything is okay? Hey, like sometimes I just want you to that, like, just treat me like everyone else. If you didn't know I had this thing, you will not be here marking every symptom, everything, linking everything I do to a symptom. Like, just let me be. It's really not nice at all. I mean, at the beginning of my road to recovery, at the beginning of my mental health journey, there were times that you do something, it's like, are you taking your medication? What do you mean by, am I taking my medication? What have I done for you to even think I'm not taking my med? And even this whole world, I think the person who would not want me to relapse are my biggest supporter of I don't want to relapse. So if you are worried, I'm even more worried than you yourself. Uh-huh. So it's just part of the journey.
It just goes to show that there's still a long way to go. As much as we're talking more about mental
Oh
health
yeah,
in 2025, and it's becoming an open conversation, there's still a long way to go because even the most educated people are quite ignorant about it, sadly. It's not just about
oh yeah,
people who are in the rural areas, it's not about uneducated or people who are in the rural areas not knowing. Even educated people have an issue of stigmatizing. So we have a long way to go, but this way, the beauty of an essay. You are in Ghana, I'm in South Africa, and our advocacy work in mental health has connected us, and it's beyond borders.
yeah,
And I would not have gone to Ghana because it was because of the work that I do in mental health advocacy with Professor Ofori Atta, who had come to South Africa. So a
yeah,
lot is being done. It's really incredible, and we have more in common than not. There's still a very long way to go, and I think collaborating and working together is going to be the solution for us to unite. And it really, I developed a greater passion about mental health in Africa, particularly because I saw how far we still need to go
yeah.
related to mental health education.
I got into advocacy because I realized that at the beginning of my journey, the reason why I was in deep denial, apart from the faith thing, was that I did not know anybody who had lived experience with a mental health condition. I thought I was the only one. In fact, the other people I thought were the people on the streets who were vagrants who had lost their mind. So I thought I would soon, it's just a matter of time, I will soon end up like them. I didn't know anybody like that. So that's what made it difficult for me to accept that I could take my meds and still live a very high quality of life. I actually thought maybe my doctors were lying to me. They were just making this whole thing up for me to take this medication, but it's not possible. You don't have to go through the valley. Sometimes you can just climb the mountain as soon as you start your journey. That's what I believe in, and I said I will share my story. So, Dr. Samke, for you, when it comes to advocacy, so what drives you every day?
When I experienced stigma in all its might and the risk that it took, when I had the episode that I told you about in 5 years ago, my close friends were so afraid that I'd commit suicide.
Oh, okay.
because of the trauma. Even though I wasn't suicidal, I really was traumatized. And I realized that people stopped seeing Samke, the doctor, Samke this, Samke that. I became the illness. Like I didn't matter. I I just thought, but I know that I was unwell, but the way stigma is so unforgiving, if it makes sense.
Yeah.
Stigma is so unforgiving that what you do when you're ill becomes the definition. So that was
Yeah.
one. So I felt that everything that could go wrong in my life went wrong. The worst had happened and there was no need to hide anymore. And then I say that that's when I was reborn into my work, my passion, that's number one. The second thing is after I had that particular relapse, I was booked on incapacity leave for 6 months. So I realized that if your illness is not controlled, you could be, like you're saying, psychosocial disability. You don't have to be disabled by your illness. If you have the right care, the right support, the right infrastructure, multidisciplinary team, good support system, self care, medication, if you do all those things, I always say that I am not surviving with bipolar disorder, but I'm thriving despite it. But in
Yeah.
order to thrive with bipolar disorder, the right things need to be in place. So I just have seen how disabling this condition can be. And I realized that that is preventable.
Yeah.
So to eradicate stigma, I use myself to say, I am Dr. Samke Ngcobo, lived experience with mental illness, bipolar disorder type 1. But here I am. I'm a brilliant doctor. I'm a brilliant friend. I'm brilliant. And I'm not saying it out of arrogance, but at the same time, I'm living with this condition. And I want to be a symbol of hope and encouragement. And I don't
Yeah.
have to be disabled by my condition. It can be disabling, and it did disable me for 6 months of my life. But I got up, I wrote my book during my incapacity leave. It doesn't mean that I have to be defined by the condition. So I
Yeah.
want to change the narrative about mental illness that yes, bipolar disorder is a daunting illness, but you don't have to be defined by it.
Thank you so much for sharing your story with the world. I always say that whenever I put videos on my channel, it may not save people just today, maybe in the future. More and more people, whether we like it or not, more people will be diagnosed. And so I just want to make that transition for them easier. I have a friend that when she was newly diagnosed, my fear for her was she may not accept the things that she will need to manage the illness. But I think because she had seen how I had been operating with this illness, living my life, it just made her, she saw it like, oh, it's fine. I just need to take my medication, go for review, go for therapy, do everything, my self care. I'll be fine. And she's actually really fine. She's in university. I'm like, wow, you had it easy. You didn't go through some deep denial and all of that. So I'm glad we are doing that, the work that we are doing. And hopefully, 5 years from now, all the work will see more results because I see it every day. The results are there. Things are improving. The way people say and think about mental health, it's improving. But you are right, there's more that needs to be done. Do you have any final words?
I'm just saying, my illness was supposed to be, they say all things work together for the good of those who love the Lord.
Yes.
You don't have to be religious to believe that. But
Yeah.
my illness is something that was supposed to be my stumbling block, but God
Yeah.
has used it for me it actually is a part of my purpose. And
Yeah.
even in my book, I comment and say, if I didn't have bipolar disorder, who would I be?
Yeah.
I wouldn't be Dr. Samke. I wouldn't be the Dr. Samke that you know today, the one you're
Yeah.
talking to now. I would be a doctor, yes, but I wouldn't be, vocal mentality wouldn't exist, the
Yeah.
platform. My
Yeah.
company is because I had the illness where I thought, let me create something bigger than me. Vocalmentality.com is so precious to me for the fact that I remember when in medical school and I was struggling with my illness, I would Google because we had a computer at home. I would
Mm,
try and Google to try and understand, and I never had the answers that I was looking for. And I wanted to create, I just envisioned somebody going onto my platform and having a symbol of hope of somebody that is a doctor, is doing well in life, but living with it and not defined by it.
yeah.
So my final words are to say, you don't have to survive or be disabled by bipolar disorder, but you can thrive despite it. And secondly, you don't have to be a victim of stigma and be crippled by stigma. And if
Mm,
you overcome self stigma, you will overcome the rest.
yeah.
And I am a living example that overcoming self stigma can empower you to go beyond. Anything is possible. And I hope that my conversation with you, Essay, saves at least one life, if not more. Thank you.
Oh, thank you so much, Dr. Samke. I really enjoyed talking with you. In fact, I did not want this conversation to end, but it definitely has to end. Every time I hear you speak, it's like, oh, I have a twin, a twin
A
across.
sister.
Yes, like a sister. Like, thank you so much for sharing that. If you can overcome self stigma, you can overcome the rest. It's very, very true. So, thank you for coming on the mental health quarters. I hope that one day we can also film a video in person, like together. Maybe you come to Ghana again, or I'll come to South Africa.
Oh no, I would live for a week for the first time, and the week went by so fast. I was so busy doing my advocacy work, so I
Yeah,
have to come back there. And when I come back there, I will definitely see you and give you a big hug. It's as if we've met before and we've never met in person. So when I'm
yeah,
back in Ghana, I will definitely let you know, and we will do something in person and shoot a video. Like I'm saying, we have more in common than not,
yeah,
as people in Africa and the world. And I
yeah.
think if we focus more on what we have in common than not, we will achieve more.
Yeah. That's very, very true. So, thank you very much. We'll see you again in another video and we wish you all the best. So, guys, I'll put all the links to everything that she has mentioned in the description box, the link to her website, the book, her Instagram page. You should definitely follow all these pages and get to know more about the amazing work that she's doing in South Africa and internationally. So, thank you so much for staying to the end of the video. Bye.